Dr. Sean Caesar, naturopathic doctor here in Winnipeg with a focus on cancer. I'd like to introduce you to Winston, who is one of our patients here at the clinic. He's a stage 4 prostate cancer patient. This is not a testimonial, it's a case study, and I wanted you to hear it through him as such a vital character. I hope that you really enjoy his story and follow him along through, because I think you'll get a lot out of this.
The urologist I saw first said, well, I gave you a year and a half. But with the new drugs out there, probably longer. Anywhere from a year and a half to, at the very most, 5 years. And here I am almost 7 years later and feeling great. My name is Winston Pinner. I'm a senior citizen, as you can see looking at me. And I'm 80 years old. Back in 2012, I was beginning to have a lot of discomfort in my right leg, especially the knee area and up, and well, especially the knee area. And I thought that came from a skiing mishap I'd had when I was a teenager, and my knee got twisted very badly. And it had been bothering me off and on over all the years, but now in my older age it was really starting to bother me, but I thought it was just arthritis setting in. And I was using painkillers, both natural and regular painkillers, and I saw some chiropractors. All of this helped some, but the problem was not going away. In fact, by 2014, the spring of 2014, I had to use a walker to walk. It's the only way I could get around is with a walker. Going up the stairs, I had to crawl up the stairs, leave the walker downstairs, and then somebody would throw me crutches up, and coming downstairs, I had to back down, crawl down backwards, and so things were not going well. But anyway, I kind of put off going to a doctor. I was so sure it was arthritis. But finally, when it got so bad that I just couldn't walk anymore without a walker, I decided it's time to have a doctor look at it. And so I went to a walk-in clinic here in Winnipeg and saw a doctor there, and the doctor kind of agreed it could very well be arthritis, and he was going to give me a cortisone shot, and that's what I really wanted too. But he said we better x-ray that leg first, and so he x-rayed the leg, and then I had to wait for a while. He let me out of his office, and I had to go back in once he was ready to talk to me about the x-ray. And he said, Winston, there's something wrong higher up. It's not really your knee at all. I don't like what I see higher up between your knee and your pelvis in the leg bone there. And well, that was a bit alarming, but okay. In fact, he told me that spot, and that's a fairly big spot, looks so bad. I don't want you to put any weight on that leg at all anymore. Just use crutches, no walker. And then he said, before you leave here, we're going to do a blood test as well. And so that's what they did there in the clinic. The next day, this doctor called me and he said my PSA was extremely high, very high. And he said, you know what, you will have to be admitted to the Seven Oaks Hospital, and they'll have to insert a metal pin surgically. That's the only way. And don't put any weight on that leg whatsoever. It's going to fracture. He had also ordered a bone scan and a CAT scan, which I had at the Winnipeg Clinic and at the St. Boniface Hospital. And when all these results came in, it didn't look good. They also said I'd have to go to the Health Sciences Center for radiation. And so I did that. I had 10 rounds of radiation. I had a urologist there by that time. And this urologist told me, yes, we'll do the radiation, but your lifeline is the hormone injection. They were giving me a hormone injection into my stomach area with a big needle. And this urologist said, that's your lifeline. And well, so that was all rather alarming, to say the least. But I went through with the 10 rounds of radiation, and with the Zoladex injections, and my PSA started coming down. It went down a lot. Still, the long-term prognosis was not good. Was not good at all. They weren't giving me much of a chance. I also had to see, or what happened really, and this was quite remarkable, instead of me asking to see an oncologist at the Health Sciences Center, the oncologist office called me and said, we want to see you. We've heard about you, we want to see you. We believe we can help you. Well, that sounded good. And so I went in and I saw the cancer specialist there, and and I was told, yes, you have stage 4 prostate cancer. Not good news. And they spread to various parts of your body, your pelvis, your lumbar, your left shoulder, and there are even 2 spots on your lung. But then he said something that just, well, I don't know, just did wonders for me. He said, but Winston, there is reason for optimism. Wow. Yeah, he said, but we can help you. I'm going to prescribe chemo, and we'll see how things go. And so I had a long series of chemo treatments in Steinbeck at the cancer care there, and of course still had the Zoladex injections every 3 months, and my PSA was by now quite stable, just in the 20s, and so that was very encouraging. But as time passed on, and my chemo was done, my PSA started climbing again, quite much, to the point where they said, well, yes, we have something else for you. We're going to give you a fairly new drug, relatively new, called enzalutamide. And we think it'll work for you. And it did. After they gave me enzalutamide, my PSA started dropping. From in the 20s, it went down to under 1. Well, that was great news. And it stayed low for quite a while. But then I guess my body was building up resistance, or the cancer was building up resistance, and my PSA started climbing again. So what now? Well, this of course was after many months, maybe even a year. My cancer specialist said we can also try radium-223 treatments. Those will be injected intravenously, and we'll try that as well now. And they did, and I think it helped. All of this helped. All of these treatments helped me. I responded to every one of them. But I was not cancer-free, and my PSA started climbing again. And so I had gone through just about everything they could do for me. And then I remembered a friend of mine had suggested a natural treatment clinic in Winnipeg, and the doctor's name running it was Dr. Sean Caesar, and he highly recommended him. Well, I thought, what's there to lose? And so I consulted the natural, or the clinic here, the Natural Cancer Treatment Clinic, and Dr. Caesar, and I arranged a consultation. That was already now in the summer, August of 2019, going back a year and a half now. So a lot of things had been happening here, but I was down to where I thought, well, I'm not giving up. I want to keep going. And so my wife and I and one of our daughters went in to see Dr. Caesar, and we had a consultation, and it went well. Dr. Caesar recommended a different diet, a healthy diet, and while he did not pressure me, but he thought it would be a good idea to take natural treatments, but he said it's got to be your decision. And so we went home and we talked more about it, consulted the family and so on, and then yes, together with the family, I decided I would go for these natural treatments for 3 months. And, you know, I just want to say it was just so good to come in here. Dr. Caesar, with his great bedside manners, and the office people always so friendly, and the assistants to Dr. Caesar also very nice to work with and so on. So the experience here was really good. And so now I'm still here after a year and a half. At first I took 2 natural treatments a week, and that went down to once a week, and now I'm coming in once every 2 weeks. And I'm feeling great. I have no pain. I have a very good appetite, too good. My wife was a good cook, so that's a greater problem than not having an appetite. And also I'm a cyclist. I enjoy cycling, have for years. In fact, my wife and I together have done a lot of cycling. And this past summer, I was able to cycle some days 40 miles and even 50 miles. We heat our home back where we live with wood, and so there's a lot of pretty heavy work too. Getting a chainsaw out and cutting firewood, loading it onto a trailer, hauling it home, and all of these things I'm still doing. And so I'm just so grateful where I am now. And I do want to, as I close, attribute, give honor to whom honor is due. And I want to start with the Seven Oaks Hospital and the surgeon that inserted that pin. That did wonders for me. I had to walk on crutches for a while after it, but more and more, like I got stronger, and that leg got stronger and better, to finally I didn't even feel I had that pin anymore. So that was great. And also then my cancer specialist at the healthcare, at the health sciences, at the cancer care at health sciences. Such a wonderful person and understanding, caring. And so I want to give a lot of credit to him as well, and the chemo treatments and all of that. And then the healthcare workers in Steinbach at cancer care there, the frontline workers. They've been so accommodating and helpful and friendly, and so my hat's off to them. And then of course here at this clinic, as I've said already, with Dr. Caesar and his people here. It's just been such a good thing for me, a good experience. And then of course, as a Christian believer, I want to give credit to our physician, the great physician in heaven. He's been watching over me all this time. And the many prayers, many friends, all of this working together. And then of course, my own family, so supportive. My wife and my children, my sons-in-law, daughter-in-law, and our grandchildren, all of them pulling for Grandpa and showing so much love. And so, you know, all around, I am just so thankful for my quality of life, and I feel very loved, and I'm so happy that I can end this video on a positive note, I know I'm not cancer free, but my cancer is very much under control. And so thank you everyone for listening, and I hope many of you find this encouraging as well.